Hey, welcome back. Congratulations for making it to Module 6. We're super excited that you've endured the 5 modules prior to this one. And this module is the closing module for this series of the Community Addiction Partner training. So we thank you so much for being here, and we hope that you find this module just as informative as the previous modules. And really look forward to you incorporating all of the knowledge that you've learned and gained in this series into your practice and educating others, because it's only through you and educating yourselves and sharing what you've learned can we change the narrative and improve outcomes on addiction and recovery. So thank you for being here. This module is on harm reduction. I'd like to preface this module by saying to you that, first of all, it is an introductory module on the concept of harm reduction. It is by no means a thorough representation of all that the concept of harm reduction includes and entails. So please seek further education and information on the concept of harm reduction after this introductory module, and that this information might challenge your beliefs. It is definitely a new way of thinking for many people. And what we have witnessed is people who really are standoffish about the harm reduction model after attending 1 or 2 training sessions, that there is a paradigm shift. And it's really a necessary paradigm shift if we're really going to globally address this public health crisis that we're experiencing right now. So please know that some of your beliefs might be challenged, and I really strongly invite you to keep an open mind throughout this series. So let's go ahead and move forward with our first session on harm reduction. All right, here we go. Module 6, first thing we are going to talk about in harm reduction is we're going to revisit the definition of recovery. I like this image because it says harm reduction saved my life. And if you ever hear anyone who provides a testimony about this concept of harm reduction impacted their lives, what you will hear from them is a deep, heartfelt, passionate story about how this methodology really did save their life. And at the end of the day, that's what the harm reduction model does, is save lives. And we're going to take a look at that. Let's just remind ourselves of the definition of recovery provided to us by SAMHSA, which is, again, the Substance Abuse Mental Health Service Administration. And they define it as a process of change, through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. And we can break this definition down in so many different ways to really emphasize its relativity to harm reduction. And maybe we'll do that at the end of this series. And then reminding ourselves that the 2005 definition included the word abstinence. The most recent version, the most recent definition of recovery does not include abstinence. And so harm reduction really can take a moderation-based approach. And what we really want to think about with the harm reduction model, and I've said this throughout this training series, is reducing the negative consequences associated with drug use. It doesn't necessarily mean abstinence. It can include drug use goals, improved health and well-being, and reducing the negative consequences associated with drug use. That's where harm reduction really comes in as an effective model at a global level. And then a reminder again of the Canada definition of what is recovery. I believe this is the UK actually. A mental health problem or illness or substance use can still live a satisfying, hopeful, and contributing life, right? Not giving up on people. The pursuit of that journey, the pursuit of their journey, it's a process, folks, and people are going to try different ways to try to figure it out. There's no cookie cutter mold to helping somebody move through chaotic drug use to sustained recovery or abstinence. The pursuit of that journey is at the heart of recovery, a concept whose principles include hope, dignity, self-determination, and responsibility. So this is from Canada, the Mental Health Mission. So let me ask you, when you hear the term harm reduction, what comes to mind? What are you thinking about? When we think about harm reduction in this model that we're discussing today, we're referring to harm reduction as saving lives. How can we save the lives of people who use drugs and promote safety, reduce public health diseases, and improve the lives of society? That's the harm reduction model. Saving lives, improving public health. We see this SOS wrapped. We know automatically what it means, right? Somebody's drowning, somebody's in danger, we throw them a lifesaver. I invite you to think about harm reduction as a life-saving model. We have harm reduction models all around us in our daily lives. It probably has just never been labeled as harm reduction. And so I'm going to point a few of these things out to you. For example, a parachute when somebody's jumping out of a plane is a method of harm reduction because it reduces the risk of fatality. How about personal protective equipment? We now know this term very, very fluidly in our world. It reduces the spread of disease, right, by using our PPE. We look at condoms. How about helmets or seatbelts? All of these things, airbags, are harm reduction models. And I can remember when I was a young adult, seatbelts were not mandatory. I don't even think they were mandatory when I was getting my license, but this is what what we call progress. And seatbelts weren't mandatory until the data came in and said seatbelt saves lives, and then it became, widely accepted as a global law. And now it's a social norm. And same thing with bike helmets. People didn't used to wear bike helmets, nor was it a law in any state or at a federal level. And now it is, right? For children under such an age, they have to wear helmets. Same thing with children riding in the back of cars. Folks, all of these are harm reduction strategies. They reduce injury, reduce disease, and save lives. And that's what this harm reduction model does relative to substance use disorder and injection drug use. So how are you doing so far? Are you having a paradigm shift? I hope so. So harm reduction, according to the National Harm Reduction Coalition, it's a social movement built on a belief in and a respect for the rights of people who use drugs. Now, this is a much broader discussion, and I invite you to continue on with your learning on harm reduction model relative to this statement. What we're going to talk about in this module is a set of practical strategies and ideas aimed at reducing the negative consequences, once again, right, reducing the negative consequences associated that come alongside drug use. That's the harm reduction model. According to Harm Reduction International, harm reduction is a set of evidence-based practices that minimize, here we are again, the negative impacts of drug use and ineffective drug policies. Harm reduction is grounded in principles that protect human rights and improve public health. Seatbelts, bike helmets, personal protective equipment. It incorporates a wide array of approaches, including abstinence, but not limited to, designed to meet people where they are and offer opportunities for people to improve their health and well-being. We have found that individuals through syringe exchange programs have entered into a pathway of recovery by the simple engagement with the workers of the syringe exchange program. And as a sort of byproduct of the syringe exchange program, more people are entering into improved health and well-being. So it's really a powerful movement and a powerful model. So harm reduction is not, there's a lot of myths, there's a lot of hoopla, a lot of scuttlebutt. People don't like to talk about this harm reduction because they think that harm reduction is a way of promoting the use of drugs, right? They think it's only meeting people where they're at and not offering any type of improvement or advocacy or recovery opportunities. But really what it's doing is supporting folks to change behavior. Harm reduction is not helping a person who has stopped using drugs figure out how to start using again. And harm reduction is not condoning, endorsing, or encouraging drug use. And it is certainly not legalization. I'll reiterate it again that harm reduction is a way of protecting the people who are using drugs, who experience substance use disorder currently. It is a way to keep them alive until there is treatment available, until they find the right pathway for them, until they are ready to make that move into sustainable recovery. Harm reduction saves lives. Harm reduction is a framework for people who use drugs to strive for any positive change. And we'll talk about some of that positive change in the next few slides. It is person-driven. It is not coercive. It is not bribery. We do not say, if you do this, then that. What we do in the harm reduction model is offer education and clean needles and opportunities to test your drugs, to dispose of your dirty needles, to keep them off the streets, from keeping other people from getting infected or stuck by the needle. We think of our law enforcement and our first responders and our kids. It's supportive, not punitive. We're not going to punish people for coming to get some clean needles. It is a very supportive environment to improve their health and well-being. It is a framework for understanding drugs and drug use, and it's viewed through the lens of science, not morality. People are going to use drugs, people are going to inject drugs, and what this model does is it says, if you are of low socioeconomic status and you are homeless and you cannot find clean needles, and you cannot test your drugs, we at least want you to stay alive so that we can help you. It acknowledges that some drugs are safer than others, and it acknowledges and addresses the context of use. And again, this statement here, actually a couple of these statements here, are of a much broader understanding of the harm reduction model. And again, I encourage you to seek additional training, as this is an introductory module.
Hey there, this is Ginger. I hope you're learning a lot from this series. I'm asking for your help in supporting my tireless efforts. There's a few ways in which you can support me. Tell your friends about this video series, subscribe and like each video here on YouTube down below, make a donation on my website, or invite me to deliver this training in person. Together, we can all be part of the solution. Hope to see you soon, and thank you.